Senator Murray.
Thank you, Mr. Chairman. In May, Secretary Kennedy announced in a video on social media that the COVID vaccine was no longer going to be recommended under CDC guidelines for most children and pregnant women. The fallout was actually immediate. I heard from a nurse in my state who was pregnant. She was trying to get the vaccine. She was turned away by several pharmacies, ended up calling my office and saying, what am I going to do? Dr. Howery, I wanted to ask you, how did you learn about CDC's new COVID vaccination guidance in May?
The same as you on social media.
What was your title at CDC when that happened?
I was the chief medical officer of the agency.
It's unthinkable to me that the chief medical officer at CDC was left in the dark about such a consequential public health decision that affected real people. Dr. Howery, how was this change in guidance supported by scientific evidence?
We have not seen the data yet. In fact, after the tweet came out, we asked for a written memo from HHS because I couldn't implement guidance off of a tweet. The written memo didn't say the same as the video. There was a difference between healthy versus all.
You can't provide guidance off of a tweet.
I didn't think that was prudent. And then we did ask for the data to back it up, and we have not received the data to date.
To date, no evidence. Okay. Well, the Secretary has made very clear that he wants to change the childhood vaccine schedule for measles and chickenpox and Hep B, as well as the COVID vaccine recommendations. And as we all know, the ACIP is meeting tomorrow to consider those recommendations. Dr. Menares and Dr. Howery, I want to ask you both, are you aware of any scientific evidence to support changing the age of which children should get these vaccines that's being considered by this advisory committee? Dr. Menares.
Sorry, I apologize. I am not. I was certainly open if there were scientific data sets or evidence associated with anything that would help keep our children safe. I was open to seeing it. I have not seen that data.
Dr. Howery?
Ditto. We've asked for the data and asked for the modeling to support any decision that is done.
Are either of you aware of any scientific evidence?
Former CDC officials delivered stunning testimony during a Senate hearing after being questioned by Senator Patty Murray about changes to COVID-19 vaccine guidance. One former CDC chief medical officer testified that she learned about a major vaccine policy change through social media and said the agency had not received the scientific data requested to support the decision. The hearing also focused on concerns surrounding the Advisory Committee on Immunization Practices, ACIP, recent leadership changes, and questions about transparency in the vaccine recommendation process.
About the ACIP. Dr. Menares, you mentioned that Secretary Kennedy asked you to pre-approve the September ACIP vaccinations a month before the committee was scheduled to meet without knowing what they were or what evidence that was based on, correct?
Correct.
I find that troubling and ironic, given what Secretary Kennedy said in June when he fired all 17 members of the ACIP without cause and called them, quote, a little more than a rubber stamp. That's exactly what he wanted you to be for the new board, for his new board of unqualified vaccine skeptines. The former members of ACIP actually met in April. Dr. Menares and Dr. Howery, would you feel confident telling parents they could trust the recommendations of the advisory committee that were made back in April? Before they were fired.
Yeah, I would say that the individuals that were participating in April had the commensurate skill sets and background to be able to evaluate the decisions before them. The processes were regular in terms of using the evidence to recommend. There was working groups that substantiated the information. There was robust deliberation during the ACIP meeting. I would say that it comported to the standards where the Americans could trust them.
Dr. Harris?
Agree. The data was presented and the committee was filled with experts with experience.
The newly chosen ACIP members met in June, and they're going to meet again tomorrow. Will you, either of you, feel confident telling parents they can now trust the ACIP recommendations that come out of this week's meeting?
I'm very nervous about it. I don't know. They haven't met yet. I know that the medical community has raised concerns about whether or not, again, they have the commensurate backgrounds to be able to understand the data and the evidence and to evaluate it appropriately. I haven't prejudged. I don't know what will happen, but I certainly will be watching.
Dr. Howard?
I have significant concerns as the public hasn't been able to weigh in. The general vote should have been posted 2 weeks ago so the public knew what was being discussed other than high-level things. There haven't been work groups other than for COVID, and there haven't been, as of yesterday, the data hadn't been posted yet. So it's unclear to me what decisions are being made.
Thank you. Thank you very much, Mr. Chairman.
Senator.
Please, don't forget to like, subscribe, and turn on notifications for more political hearings, breaking news, and congressional highlights, ***.